What did Dr. Konstantin Buteyko observe? Well, in 1957, he was sitting at sick patients' bedsides and he noticed that their breathing was pretty poor. He saw that they were breathing faster and harder, upper chest breathing, often having the mouth open with irregular breathing patterns. So he began to wonder, was it their sickness that was causing them to breathe this way? Or was it their breathing pattern which was feeding back into their sickness? So let's just tease that out a bit. I think it was a really, really important observation. It's all too easy to say that this person is breathing poorly because they are feeling unwell, and not to take into consideration how this poor breathing is putting them into a stress response. So what is dysfunctional breathing? The best way to think about poor breathing patterns is, how do you breathe when you get stressed? And you know that when you get stressed, your breathing is going to speed up. So you breathe faster, you breathe more breaths per minute. You're likely to breathe harder. So as you breathe air into the lungs, you're taking bigger breaths. You may have irregular breathing patterns, you're sighing more or you're stopping breathing. You might feel that you're not getting enough air, so you breathe in the upper chest. And you also may have your mouth open, and your breathing can feel effortful. And this is what Dr. Buteyko noticed about his sick patients. They were breathing this way. When we breathe this way, we're not increasing oxygenation of tissues and organs. On the contrary, our faster and harder breathing is going to get rid of too much carbon dioxide. That in turn is going to cause blood vessels to constrict, and also the loss of carbon dioxide drives up blood pH, which increases brain cell excitability. And the third factor, the loss of carbon dioxide and the resultant increase to blood pH, that hemoglobin, which is the main carrier of oxygen in the blood, holds onto oxygen too strongly. So these people, they are sick and their breathing pattern is actually reducing tissue oxygenation. But it's not only that, because the manner in which they are breathing, irregular breathing, faster breathing, harder breathing, chest breathing, mouth breathing, this is going to tip the nervous system into an increased stress response. And people who are sick, either mentally or physically sick, they're often in that increased sympathetic drive or increased stress response, increased fight or flight response. And the word sympathetic in this instance means that all resources are mobilized to help this person. We can't stay that way long term. And here's the question. If we're sick and we're reducing tissue oxygenation, we're reducing our blood circulation, we're in an increased stress response, is that going to help us recover? Surely the most fundamental elements that we need to address here is look at the basic function of breathing and how to improve this person's breathing pattern to help them on the road to recovery. So how should we approach this then? Instead of breathing faster, we want to be breathing slower. So we slow down the respiratory rate, but of course it's not just about that. Also, instead of breathing harder, we want to be breathing lighter. Instead of breathing irregular, we want to have regular breathing patterns. Instead of breathing upper chest predominantly, we want to have good recruitment of the diaphragm. Instead of breathing through the mouth, we need to be breathing through the nose. And instead of having effortful breathing, we want to have effortless breathing. This is improving our blood circulation. It's improving our oxygenation of the body. It's helping to bring balance to the nervous system. It's improving the person's sleep quality. It's reducing their anxiety. And this is going to help on the path of recovery. That's what the Buteyko is about. How are you breathing every minute, every hour, every day? And what's your breathing pattern doing to your body and mind?